Imagine waking up one morning only to find out that you're suddenly turning into a tree. Yes, you heard me right, a tree. So the transformation probably started from somewhere on your hands, and then your hands suddenly transformed from looking like something like this to looking like something like this. Think about it for a moment. What would you do if that happened to you? Tree-man syndrome, also known as epidermodysplasia verruciformis, is an extremely rare skin disorder that can cause bark-like growths on the skin. Tree-man syndrome is an inherited genetic disorder. It makes people extremely susceptible to the human papillomavirus, and it usually results in infection with the HPV becoming chronic. Most people would come in contact with HPV at some point in their lives, but people with tree-man syndrome are more susceptible to contracting the HPV virus because the condition makes their immune system function in a way that makes them more likely to develop this infection. Over time, this infection causes skin growth, such as viral warts, which in severe cases may develop bark-like growths. When I say bark, I mean like a tree bark. So what are the symptoms of someone that has tree-man syndrome? Well, you notice, like I said earlier, bark-like growths, which usually develop on their hands and their feet. They may also have scaly or raised patches on their skin called plaques, or they may have small pink, reddish-brown growths called papules. Warts tend to occur in clusters on their skin, and they commonly form on areas that are exposed to the sun, such as the hands, the feet, the face, and the earlobes. Although people with tree-man syndrome can experience symptoms on any part of their body. Although as of today there is no cure for tree-man syndrome, some lifestyle changes and therapies can help to manage this condition. Some of them include drugs called topical retinoids, 𝐭𝐡𝐢𝐤, which is a medication that is similar to vitamin D, interferon alpha, which contains a natural compound that reduces cell growth and cell division, especially in cancer cells. This can also help to treat viral infections. Avoiding the sun and of course quitting smoking can also help to manage this condition. The world of medicine just keeps getting stranger and stranger, doesn't it? I guess you can see why being a doctor is fun. Well, if you're enjoying this series so far, join me once again next week for another exciting episode of Bizarre Medical Conditions.